Hey everybody, so today I want to introduce you to our newest provider, Dr. Joel Williams. And what's interesting about Joel is his background is actually that he's a chiropractor. So you're probably wondering, what on earth is a chiropractor going to do with a bunch of physical therapists? Well, exciting news, he's actually what's called a rehab chiropractor. So I thought it'd be fun to introduce Joel to you guys and talk a little bit about his background and what got him into this field of rehab chiropractic and what exactly it is. So, Joel, welcome to the team at CJPT and Pilates. So Joel, just tell us a little bit, quick version, what actually made you want to become a chiropractor?
So starting in undergrad, I was studying exercise science and I was actually on the PT route, believe it or not. And I started to play golf, I was about 20 years old, and I started to get back pain. And I went and saw a chiropractor and I had one adjustment and it was gone completely. So, I was like, wow, that's magic. I'm going to put PT aside, let's do chiropractic. So it's funny because all these years later, I went through chiropractic school and I kind of realized there was something more I wanted to get out of what I'm doing with patients. And I realized going and blending into the PT route and doing that together is what could get those results that I was looking for.
And in your field, that's what they call a rehab chiropractor. So you've been trained like a traditional chiropractor, but now you've gone on and you focus more on the whole body beyond just like the traditional chiropractic adjustments, and you help people in the same way that we do, right?
Yes, correct.
Cool. If someone came in, for example, with back pain or neck pain or a shoulder or a knee problem, what might a session like that look like with you, compared to what people think of as a traditional chiropractor?
Yeah, I mean, the most important thing you got to do first is you have to have a really good exam analysis, and you're looking at the body part that hurts, but you're looking at the person as a whole. Right? And you're constantly relating that back to what do they want to do, what can't they do because of that pain. So what that looks like when someone comes in is doing a full exam, looking at movements, what exactly is hurting, what is it they can't do, and starting to build a plan around getting them back to those things. That can look like adjustments, but that's really just a modality we use to increase range of motion and decrease pain. There's all other kinds of things we can do, from every modality that a lot of physical therapists use, regeneration, stuff like that. So ultimately we combine that with exercise and create a plan for that person to get them where they want to be.
So you could have practiced in a traditional chiropractic office. What attracted you to come and work here at CJPT and Pilates?
So what I found coming out of school is I was getting some good results with people through traditional chiropractic, like adjustments, but I really found to get them to that next step and what they were really wanting to do required more, which ultimately what they were missing is some form of exercise and really fixing what would be the root cause of what their issue is. I found that chiropractic and adjustments was really kind of, I don't want to say a band-aid, but it was really just masking up what was going on. So they needed a little bit more to get where they wanted to be.
So one thing that we've always said here, and tell me, what you think about this statement. So when I talk with people about how to truly recover from an injury, let's say it's back pain, when people overdo, I call them passive modalities, and traditional chiropractic adjustments we put in that category because it's a passive modality. It's something that someone's doing to you, even acupuncture, massage, things like that. Even some of the things we do are passive modalities, dry needling. But when you only do passive modalities, it can sometimes be a band-aid, and it's only one small piece of the entire puzzle. Once you can use those things, chiropractic adjustments included, to quickly modulate pain and influence tissue, right, and blood flow. But once you do all those things, you need to add in the movement and restore the movement, get the nervous system kind of reworking itself again so that you can kind of undo compensations that got you there. So it sounds like you felt like that was missing in kind of sticking with just a traditional chiropractic route.
Yeah, and I think you're spot on with that because the ultimate goal is for someone to come in and to be able to leave in a better state, but also to be able to take care of themselves.
Right, exactly. Right. How do you see yourself working alongside the physical therapist here?
Honestly, I see myself working pretty much exactly the same way. There's a little bit of expertise I might have in a couple little things, but really we're going to be able to blend and bounce ideas off each other to help people the best we can.
What's maybe one thing from your background, whether it be just in the way you've practiced, before coming here, or even just from your traditional chiropractic education? What's one thing that you're excited to maybe bring here and share with the team?
Obviously, some adjustment or manipulation skills, but I've actually spent a lot of time working with people throughout a rehabilitation route, specifically with like strength training. I know a lot of the PTs here have done that too, but the thing about working with something like that is there's a million different ideas you have. So I think it's gonna be really beneficial to our patients when we can combine all of those things.
So now just a little bit about you personally. What do you like to do outside of work?
Outside of work, I love to play sports. I love to work out. I love golf, play a lot of tennis too. And besides that, it's just eating and reading and going to bed.
Awesome. A lot of people come to see us, they think, oh, I've tried physical therapy before, it won't work. They come see us, and then we have a specialized whole body approach to rehab, and then they're successful. What would you say to someone who finds out, oh, you're a chiropractor, I've tried chiropractic before, it didn't work? What would you say to them?
I mean, the first thing I want to know is what was their experience like, and that all chiropractors aren't the same, and that we actually have the ability to do so much more for our patients and really get them to where they want to be. So I'd start that with a question, and I'd want to find out what their experience was and what they were missing, so that I know if what they're missing is something I can provide for them.
All right, well, welcome to the team, Joel, and we're excited to have you, and we're excited for you to serve all our awesome patients.
Thank you.